Hello guys, everyone. Today we're going to discuss the first topic in osteology. The first topic in osteology we have vertebral column. We will discuss about each. This is the vertebral column structure. We're going to discuss each vertebra structure in cervical region, in thoracic region, lumbar region, sacrum region, and coccyx region. Because we know in vertebral column we have 33 vertebra. 33 vertebra we have, total 33 vertebra. Okay, first region we have cervical region. From C1 to C7 we have cervical vertebra. Thoracic from T1 to till 12 we have thoracic vertebra. Lumbar region we have L1 to L5 we have lumbar vertebra. Sacrum S1 to S5, but they are fused each other in the L-descent. Okay, and 3 to 4 we have coccyx vertebra. Okay, this is the simple structure which we know about the vertebral column. Each region we have vertebra, which I told you. In cervical region we have C1 to C7, means we have 7 cervical vertebra. In thoracic region we have 12 thoracic vertebra. Okay, in lumbar we have 5 thoracic vertebra, and sacrum we have 5, but they are fused each other. They are showing like a one bone, like sacrum bone. Okay, and coccyx 3 to 5 we have coccyx vertebra. Now this is like very simple classification which we know, and we heard about these things very in each simple. From some countries students are studying these vertebral columns in college. In college, in some countries they are study already in schools, but here in medicine you need to study each region, each vertebra structure, because here we will going to discuss each region, each vertebra. Why? Because every vertebra have something different. Okay, now we know, we already discussed vertebral column, what we have. Now we'll going only discuss cervical region vertebra. Okay, we have cervical region. Cervical region, cervical vertebra mean cervical vertebra. Cervical vertebra. We have 7 vertebra. Okay, 7, C1 to C7. Okay, now first we will discuss C1. C1, its own name, Atlas. Atlas, his own name. Okay, Atlas is own name of this vertebra. Atlas, we're going to discuss its structure. Okay, now which I told you is going to discuss C1 Atlas vertebra. Okay, Atlas we have first thing, Atlas is own name, Atlas. Okay, and he have no body. In Atlas body we have no body, no corpus. Corpus mean in Latin language, corpus mean body. We have no corpus in Atlas vertebra. We have no corpus. Then what we have? This is the anterior of vertebra. This is the posterior of vertebra. This is the lateral. Okay, now which formation we have? Now we are going to discuss, because we have no body. In the place of body, here we have lateral masses, which I hide here in red color. This is lateral masses. This is in the place of body. Lateral masses, both sides. Okay, lateral masses. Lateral masses both sides in Atlas vertebra. Now we will discussing the each side formation. This anterior we have anterior tubercle, anterior tubercle. Posterior side we have posterior tubercle, posterior tubercle, posterior tubercle. Here we have facet for dens, facet for dens, facet for dens, because here the on-tight process of the axis C2 vertebra articulate here. Okay, and this is the arcus of vertebra, arcus or arch of vertebra, arcus in Latin, arch of vertebra, arch of vertebra. Okay, here this is the transverse foramina, transverse foramina, foramina, transverse foramina. Why is transverse foramina? Transverse foramina only you can find in cervical region. In cervical vertebra you can find only transverse foramina, and this transverse foramina passing for the vertebral artery. Okay, here vertebral artery is passing. Okay, lateral masses we discussed, and here we have transverse process, transverse process, transverse process. Here we have articulating surfaces, fasces. In Latin, fasces called fasces. Fasces are articulate or surface. It means this is superior one, this is superior side, then it's A, and this is superior articulating surface, and inside like back inferior side we have inferior articulating surface. This is which we discuss about the atlas vertebra. Why, what thing we have different in atlas vertebra? C1 vertebra we have no body. Okay, in the place of body we have lateral masses, which we discuss. Other formation in interior we have anterior tubercle, posterior we have posterior side we have posterior tubercle. Okay, then we have arch of vertebra, transverse foramina we have, and transverse process we have in lateral side. Okay, and this is the, like commonly you can say this is the vertebral canal or vertebral foramen. Okay, vertebral canal or vertebral foramen, because in each vertebra we have this. Okay, now we will going the summary what we have in the structure which we discussed of the atlas vertebra. Okay, now we will going to discuss the summary. Summary. C1, its name atlas. What we have? No body. We have no body. No body, or in Latin you can say corpus, because corpus means body. No body. In the place of body we have formation. Formation we have lateral masses, lateral masses, then we have anterior and posterior tubercle, tubercle or tuberculum in Latin. Okay, don't forget, in Latin you can also need to study. Who are studying in Russia, you need to prepare in Latin also. Okay, then we have transverse foramina, transverse foramina, which side? Lateral side. Okay, laterally we have transverse foramina and transverse processes. Superior we have superior articulating surface, inferior we have inferior articulating surface. Okay, superior articulate with with condyles, occipital condyle, and inferior articulate with the C2 axis. Okay, this is which we discussed. This is the everything about the atlas vertebra. Okay, continue. We have second vertebra in cervical region. We have C2, its own name, axis is so known name of this vertebra. C2 is axis. Okay, this is the structure of axis vertebra. Now, this vertebra we have two parts. Okay, why we have two parts? Now we're going to discuss parts of vertebra. I will show which part we have. Okay, we have body. Yes, we have body. And we have spine, we have arcus. Yes, arcus we have also in atlas, C1 vertebra, but we have no body. But here we have corpus and we have arcus. We have corpus vertebra, first part corpus vertebra, and we have arcus vertebra. Corpus vertebra and arcus vertebra, these are the two parts of the vertebra. Okay, corpus, this is the corpus, the body, and this is the arcus, both sides, superior, interior one and posterior. This is arcus, arch of vertebra or body of vertebra. Okay, here I will also need to write for you because body and arch of vertebra. Now we discuss the formation, which the most important, and then we know to recognize this is very easily. This is C2 vertebra. What we have there? This is the we have dense process or dense process. Okay, that's the most important thing. Then for recognizing C2 vertebra or axis. Now each it's the same formation like in atlas. We have transverse processes. We have transverse foramina. Okay, we have spine process, spinous process. And we have vertebral foramina. Now here superior articulating facet forward for C1. Okay, this both side for C1, and here down we have inferior for inferior articulating process, you can say, because here we have surface C1 axis and here we have process, inferior articulating process. Now the different things which we need to know, remember, because first which we discussed is arch of vertebra, but here if this area of arch area, if they are holding the body of vertebra in interior view, like because in our body in vertebral column, body is facing interior side and spine process is posterior. Okay, the spine process is a posterior. Now the holding the body is called pedicle, and from the back side, posterior side, where the holding the spine process is called lamina. Okay, these are the things which we going to know about the C2 axis vertebra. Again, we have two parts: corpus vertebra or body of vertebra, arcus vertebra or arch of vertebra, Okay, then we have the most important thing which we know to recognize the C2 vertebra. We have dense process, then we have the same process like in atlas. We have transverse process, transverse foramina, because I already told in the transverse foramina only in cervical region. Okay, then we have spine process, superior articulating facet for C1 and inferior articulating processes. Okay, when holding the body in anterior view, this is called pedicle, and posterior view holding the spine process is called lamina. This is the structure of C2 vertebra which we know. And later how you which I told, like corpus in body and arch is a vertebra. This is the structure of C2 vertebra.